Hey everyone, we're here at ViVE 2024 and our guest is Shafiq Rab from Tufts Medicine. Welcome, Shafiq.
Well, thank you, John, for inviting me and letting me speak a few words. It's been very exciting to be at ViVE.
Yeah, it's exciting here. You know, we had you on for the CIO podcast. You talked about your Lakehouse. What are you doing to collect and aggregate the data into your Lakehouse?
So, what we do is that when we first started, we had 28 different electronic health records. So, what we do is that we use a company, 314E, and their people are helping us also with our team. And we are getting the data in a very standardized format using FHIR, but we use Python and then we do some magic to it and put it in the Lakehouse in a way that we can use it for artificial intelligence. That means both structured and unstructured data are in one place, and it makes it easier to help our patients, help our doctors, and help our nurses, and help our institution.
Awesome. They can check out the full podcast to learn all the details about the innovation you're doing there, which I think is really interesting. But how about legacy applications? How are you approaching those?
So legacy applications have always been, if you don't mind by using the word pain, and there are multiple of them. So we have to somehow get the data out and make it available for people to view it when they want it to. So 314E has helped us with that also with our people. That allows us to put our data in one place and people can view it when they need it at their leisure. So it has been a very fruitful work, makes it frictionless for our end users and makes it very helpful.
Amazing. I think you told us that you went from some massive number of applications down to a small. Tell us about that.
So we were about 800 applications. Now we are down to 200. We are working to go to 100.
Amazing. Shafiq, I'm just so impressed with what you do. Appreciate you sharing this with us. Thanks everyone for watching.
Thank you.